Hello, my name is Saron Zede. I am a registered nurse and also an RN to BSN student at St. Cloud State University. Today I am presenting my capstone synthesis for discharge education. So the focus of my capstone research was to improve discharge education methods. So I used the reviewed some relevant evidence-based practice literature and found that according to research like that from Bumpus and Stewart, that poor discharge education increases patients' risks of adverse events and accounts for 20% of readmissions within 3 weeks of discharge. To the issue that patients are not receiving adequate discharge education, the setting for my capstone project was inpatient hospital units, specifically the med-surg units. And the objective is to improve discharge education methods using this evidence-based research. Some nursing sensitive indicators are patient education compliance rates, so the amount of nurses that are following the new policies with discharge education, and patient satisfaction surveys. Some meaningful change indicators are for process measures. The process measure, the SMART goal is that in 60 days, 75% of nurses will document that they evaluated patients' understanding of discharge education through the teach back method or skills demonstration. Some outcome measure goals are in 3 months. Surveyed patient satisfaction with discharge education will increase by 10%, and in 6 months, the hospital readmission rate will have decreased by 10%. So the literature review found that the evidence supports using for discharge using the teach back method, which would be nurses teaching a patient something for their discharge and patients being able to teach it back in their own words. Skills demonstration, which would be something, like for example, if a patient's going home with a catheter, a Foley catheter, having them demonstrate that they can themselves uh, change from an overnight bag to the leg bag, or also having the patient demonstrate wound care. Similarly, caregiver education. If there's going to be a spouse or family member involved in the care, it is important to have them involved with the discharge education as well, so that you can also assess their understanding of what the patient needs. Stakeholders would be the patients because they are the ones that are going to be uh, getting the new type of discharge education. Their discharge might be prolonged for this reason. If we're evaluating a patient and the patient does not shows that maybe they're not ready to go home and perform their aftercare at discharge, they might be hospitalized a little bit longer. Caregivers, because they'll have to be involved in the education as well. So during the time of discharge, I know a lot of caregivers like to go out and, get their vehicles or, whatever, just to get the ball rolling. But to have them sit and take that time to be involved in the learning as well. Staff nurses, this might change the way that they perform discharge education. It can disrupt their flow. Charge nurses are going to be tasked with making sure that the staff nurses can comply with the new implementation of discharge education, but also that their other patients do not fall, their cares do not fall behind. They don't fall behind with the other patient cares as well. The unit manager is going to help with implementing the new evidence-based measures to make sure that they can, it happens seamlessly, and to make sure that staff have everything that they need to be able to follow through with the new policies. Quality improvement leadership, they'll be tasked with, following the data, measuring the data, make sure that the initiative has the desired effect. And in the IT department, it'd be great to have them also involved so that they can update the EHR to help ease that continuity of care so that if one nurse starts doing the discharge education and has already assessed some of the patient's understanding that there's already an area that's documented. It will also help document the compliance of nurses with the checklist for completing the discharge education. So recommendations to begin discharge education and admission, evaluate patient understanding of hospitalization and discharge instructions using the teach-back method, evaluate their abilities to perform aftercare by having patients demonstrate the skill. Ensure education materials such as brochures and videos is available in multiple languages on the units. Make interpreter services easily available for nurses to use with patients with low English proficiency and involve caregivers in discharge education. One thing that was that I found over and over again in the literature is that a main barrier to discharge education for patients is language. So having low English proficiency and no interpreter service available. Also relying on family or just no written material in that patient's language for them to take home. The timeline for implementing the first 2 months is going to be to assess the current practices and to incorporate the evidence-based practice into the current model and to get staff input because maybe they have tried something before that was similar that didn't work out, or there's something specifically for that unit that they need to do for discharge that we want to include in our policy. And then at month 3, we're going to provide the new policy to all the staff, give them the education checklist to get used to it, and then get leadership to support nursing staff with their patient flow management. Month 4 to 7 is where we're going to begin the monitoring by monitoring nursing adherence to the checklist and evidence-based practice initiative. Month 8 to 9, we're going to monitor the surveys as they return, patient satisfaction with their discharge education. And month 12 is when we're going to monitor patient data for rates of hospital readmission. So to conclude, quality discharge education with knowledge checks like the teach-back method has been shown to improve patient hospital satisfaction scores, quality of life, and self-confidence while reducing readmissions and adverse events after discharge. So it's just a quality improvement initiative that's always great to help just improve patients' confidence and to improve their overall outcome even once they leave their hospital stay. Thank you for your time. I hope you have a great day.